Good morning. It is officially the beginning of the spring semester and we're starting off with a bang. So this morning I have a huge skill assessment. It's gonna go over all the instruments that we learned in the fall semester. So if I sound a little sick, I'm still getting over a cold. But it's gonna go over exploring, area specific curettes, universal curettes, sickles, and probing. So I'm running a little late, so I'm gonna go inside and then I'll tell you more about it once I get out. Wish me luck. Alright, y'all. I just got out of the library. I was at the library studying for the perio exam. So we have a perio exam on pretty much everything we learned in the fall semester for the periodontology class. That test, I believe, is on Wednesday. But also on that day, we have, with the same professor, an oral and pathology class. We have a quiz on section 1 on the color atlas book. So that's what we were studying for in the library. And now I'm just heading home. So let me tell you a little bit about that skill assessment. So it's dark outside. No, I've been here for 12 hours from 7 to 7. But I don't even know if you guys can hear me well with this mask on. Pero the skill assessment. So we got to choose. Let me tell you in the car. Hang on. Okay, I'm in the car. My glasses are gonna start fogging up, but that's okay. So basically, for the skill assessment, I'm waiting for the car to heat up. So for the skill assessment, we got to choose what instruments we wanted to start with. So I ended up starting first with exploring, just because it was the one skill assessment in the fall semester that I did the worst in. And when she was going over kind of like what I got wrong for each instrument, this one ended up being one of my better ones, which was surprising. I put a lot of effort into practicing over the break. We had like a month or so, and the last 2 weeks, like, I locked in and I practiced sometimes even like 5 hours a day, and I finally felt like I knew what I was doing in terms of like having good control, how to position myself, and it didn't feel as awkward. And I'm not sure exactly what my exact grade is, but she said I did pass, which is really nice, but I'll have to wait till later to see the exact grade. But I did the probes first, probing, and then I did area specific curettes because those require the instrument to be adapted at 90 degrees. And I didn't want to confuse myself by switching over to sickles or the universal curettes, because those you have to angle the instrument at 70 to 80 degrees to maintain correct adaptation on the tooth. So I did probing, and then I did the area specific curettes, and then I moved on to sickles, universal curettes, and then at the end I finished with the probing. I ended up doing pretty well with the probing as well. And the tooth number, the teeth that we did was random, so it was 2 teeth. 2 teeth per instrument, anywhere in the mouth, anterior or posterior. I'm really happy that I got that over with. That's a huge weight off my shoulders. Now I'm just gonna head home. It's like 7 o'clock now. I'm gonna head home, eat, rest a little bit, and then maybe review a little bit, and then we'll start tomorrow. So I'll see you guys tomorrow. Morning. It is day 2. So today I have dental radiology. This semester there's no lab and lecture as a separate class, it's just all in one. And I think for this semester we're going to be learning how to use the sensors and the panel machine. Then after that, so that class will be from 8 to 11, and then from 11:30 to 12:30 will be dental materials lecture. And I believe later in the week, later in the week I will have the lab. That'll be, I think, about 3 hours. But we're heading over there now, and I'll see you once I get out of class. Today's Thursday. Yesterday I had my exam for the perio class, and it was basically on everything we did for the semester, and I'm really glad I passed it. I got, I think, an 86%, which is pretty good. It's a B. And then we had a quiz for perio, not period, for oral pathology, and I ended up passing that one with 100%, which I'm really excited about. But today we are going to be learning on like sharpening the instrument. I have a quiz on that. I have 3 classes today, and then this afternoon I have dental anatomy lab, and we're going to be pouring up models. So I'll try and see if I can record a little bit of that to show you, but it should be really fun. So I'll see you guys once I get out of class. Good morning. It is week 2 of the spring semester. So yesterday was Monday and the school was closed. So we missed Monday's clinic, which is okay. But today I had radiology and dental materials lecture. So with the radiology, we had a quiz first thing in the morning, and I did not do good at all on that quiz. I got like a 46%, but that's okay. It was on the syllabus and it was supposed to be on the reading, but I did not memorize any of the numbers on the syllabus, which contributed to my poor score, but that's okay. We can only go up from here. And then the quiz for dental materials, I did really well. I got 100%, and I think it's because I've been studying in groups, which has been really helpful, and I've been really cracking down on not procrastinating. And as of right now, I'm at the library here, and I'm using the whiteboard to try to memorize pretty much everything. So let me show you. So I have the PowerPoint pulled up, and then I read this a couple times, and so essentially I read this and then I went over to the whiteboard and I wrote down everything that I remembered. And I do not remember, I just keep going over again, rewriting it until I get it right. And then I'll usually rewrite it in a different color so that it stands out to me more. And I've been finding this super helpful. I've been doing a lot better on my quizzes. So if you're trying to find a good study method, I highly recommend it. So I'm gonna be here for about 2 more hours. It's currently 4:16. So I'll see how much I can get done with this. And then tomorrow, I do not have school. School was canceled. I would have had my perio class and the oral pathology class. But even though I do not have those classes, this is what I'm working on now, for oral pathology. And we're learning just on like this different types of like like what you can describe the lesions. So like with macules, patches, ulcers, erosion, scars, and things like that. And from what I've heard, that they're gonna give us like a picture on the exam, and then we're gonna have to write down and spell correctly what the lesion is. So that's my plan. So I'm gonna try to get as much done as possible for the oral class, and then I'll start for perio. For perio, we're learning about the inflammation, so that should be fun. So I'll see you guys probably tomorrow. Hi guys, long time no see. It is week 2. I haven't been recording much because it's been absolutely crazy. But right now I'm currently at the library, and as of right now I am working on a continuing education course on the radiographic landmarks for my radiology class. So it's kind of a review from last semester on how to identify different structures on the x-rays. But let me just say, this week I saw my first patient. It was on Friday, and it was a really good learning experience. And I didn't get, so the way these appointments work, they're 3.5 hours long, and they're that long because the instructors have to keep coming and checking every step of the way to make sure, you know, the patient's okay, there's no trauma to the tissues or anything like that. And they gave us a list of recall patients from the clinic, and luckily I was able to schedule 2 of the patients and then possibly a 3rd in the future. But these appointments, everything that we have to do cannot be completed in one appointment. We're just starting off, so it's going to take several appointments to complete the patient. But from what I learned this Friday, I need to be a little more organized, and I'm going to make a list of everything that I have to do with the appointments. I can show you that a little bit later once I start working on it, but as of right now, tomorrow we're going to have a skill assessment on instrument sharpening, which I'll show you a little bit later today how I've been practicing and how to actually do it. we're going to be tested on sharpening the instruments that we have been using to practice on the Dentec. And I was very surprised to learn that we're supposed to sharpen these instruments after every use. I had no idea. So I'll show you that a little bit later today, and later in the week I'll show you how I organize myself to prepare for the patient so that the appointments can be more efficient. And then for right now, since we missed 2 days of school last week, I have 4 quizzes, 2 for perio, and then two for perio and 2 for all path. So it'll be 4 quizzes back to back on Wednesday, which is kind of a lot. So I've been trying to get all that stuff done. And then on Tuesday, I have the radiology course, and we're having a skill assessment on identifying the landmarks, which shouldn't be too bad because I passed the last semester and I didn't find it like too difficult. And then after that, I have dental materials, which is a lot. There was like 60 pages we had to read. I don't know how much of information I retained from those chapters that I read yesterday, but we'll see. I have this whole wall back here is an entire whiteboard, which is why I like coming to this little room. So I'm gonna be writing down everything that I remember and then going over and filling in what I don't remember with a different color, and just keep repeating and repeating until I get it memorized, which I'm finding to be very effective. Last year I did a lot of just like rereading my slides and my notes, but it's actually pulling the information out from your brain and putting into practice, like recalling the information. That's what's been the most helpful for me. So that's the plan. And then Wednesday, those 4 quizzes I talked about. Thursday, we have a quiz on nutrition, which should be review from last semester. And then I believe there's a quiz on like the emergency manual. I have to read that. And then after that, we have dental materials lab, where I'm going to be the patient for the alginate impression. So last class, I was the one taking alginate impressions and we were pouring the models. But this time, my partner is going to be taking alginate impressions on me, on the top and bottom teeth. And then I'll be pouring stone model from like a mold, which should be really fun. I'll try to see if I can record anything. I don't think so. They're really strict about not letting us record in class, especially if it's going to capture another patient or another student. But I'll see. But I'll see you guys a little bit later, and I'll show you my progress on the whiteboard a little bit later once I finish this course. So I'll see you guys in a bit. Good morning. It is Monday, day of the skill assessment. So I have my little sharpening stone here. So the white side is more fine, and this is what we use to sharpen. And then I have my little stick here to basically check how sharp the instruments are, and then it already has scratches from last time. Then we were first practicing with a popsicle stick, but we have these instruments here that are supposed to be very dull, so that's what we've been practicing with. Let me show you really quick what a sharp instrument looks like versus a dull one. Hopefully you guys can see this, but with a dull instrument, it's just gonna slide right over. This part I had sharpened last class. Hopefully you guys can hear the difference. So this one is catching on all parts, and it's peeling. Okay, focus that. Too close, but it's catching on all parts of the instrument, whereas this other end here, it's just sliding right over. I'll show you guys more in detail once I get home, but for now I'm just gonna practice doing this right before the assessment because I haven't done a good job of practicing, and we'll see how it goes. All right, I have just gotten out of clinic. Clinic went really well. I did the skill assessment for sharpening and I passed it. I got a 95%, which is really good. Only made 2 mistakes, but that's okay. So I ended up touching the tip of the instrument with my fingers, which is an infection control problem. So we're not supposed to do that. And then when I was about to start for the area specific, the face was not perfectly parallel to the floor. So that was one mistake, but that's okay because I was able to correct it right away. But I still got marked the point off for it. And then We also got to work with the Cavitron tips. We did the slim line, which was super fun, and then we sterilized that so we can have it for the future. But right now I'm in another study room, and I'm going to be working on studying for dental materials. We're learning about the gypsum and the different types of like study models, working models, and dyes, and all that fun stuff. So I'll see you guys later today when I show you how I've been sharpening the instruments. Finally, I'll show you how we sharpen the instruments. So this is a little test stick. So this here is a sickle. So we usually just slide this across, and if it's catching like so, then it's sharp. And this other side here is blunt. So when we're going like this, it's just sliding right over. And so the way that we sharpen this would be to sharpen the heel, middle, and tip. Do that. This is a synthetic sharpening stone. This is the fine and this is the coarse. And so basically we just take a wet gauze and we wet the stone. And we do this until the gauze does not catch. See, you see the little hairs? It's catching on the stone. So we gotta wet it, keep wetting it until just basically soaks up the water, and I'll come back now that it's lubricated. Because normally we would have a loop light going, and if it reflects the light, it's dull, and if it bounces off, it is sharp. So this one has like a slight flame shape to it. Can you see that? Okay. So the way we would do this, hold the instrument on the counter or against the body. So this would be considered 90, and then we would tilt it to 70 to 80, and then we would start at the heel and then work our way to the middle and then the tip. I won't actually do it because your ears. And then we would flip it over to the other side, keeping the face parallel, and we would do 90, 90, and then 70 to 80. Start from the back and then go all the way to the front. And then we would check it again with the instrument to see if it's catching. Hello, we are in week 6. I haven't been recording consistently, but I'm glad to announce that I finished my first patient. It was quite the experience. And I have started 2 other patients and I have a 4th scheduled. So this semester we have to complete a total of 5 patients, and we need to do like 1 child patient. And the way we're seeing patients now is that they're classified as a 1 or a 0 based on how much calculus they have. And I need to have 2 1s and 3 zeros. So what I'm doing right now is just practicing on my Dentec in the library. And we have to do a couple of skill assessments. So before we were doing the skill assessments on each other to practice, but now the skill assessments are done on the patients. So I just did a probing skill assessment last week. It did not go that great, but I need to practice, and which is why I'm here. And then I have to do 1 more probing skill assessment on a patient, 2 for exploring, 1 for prophy, and then 1 for sealants. So, and then tomorrow is Friday, so tomorrow Salen is gonna be my patient, and I'm gonna try to see if I can do the self-care skill assessment where I go over the self-care instructions and maybe the exploring. So I'm gonna practice that today, and then yes, I'll see you guys tomorrow. Hello. We're officially on the last day before spring break. I haven't been recording a lot, but it's been absolutely hectic. I have my sister here, Jerusalem, with me. She's gonna be my patient today, and I'm gonna try to get her cleaning done today. So we'll see how it goes. So it's been pretty crazy, so I haven't been able to record. But yesterday we had a huge presentation where we had to dress up all nice. I kind of wish I would have recorded, but it's okay. But we got that done. I did the final for 2 of my classes, so I'm gonna be down to just 6 classes instead of 7. That doesn't make sense. Wait, how many classes do I have? Rephrase. So instead of having 8 classes, I'm gonna be down to 6, which is gonna be super nice so that I can spend more time on the other classes. But the finals went well. I passed one of them with an A and another with a B, which is all I can hope for. But have 1:30 to 5, and I'll probably get out around 7 by the time we finish cleaning up and documenting and all that fun stuff. Are you excited, Selene? Yes. I love being enthusiastic. Okay, so I'll see you guys. Okay, how do you feel, Selene?
Very good.
We finished our cleaning. I didn't think I was gonna get it done today, but we got it done. A little late, but it's done. So now it's officially the start of spring break. Yay! Mañana we're gonna go to the gym. We're gonna go to the mall, see if I can find me some shoes. And ahorita we're gonna get some pizza. So I'll see you guys. It is Monday, week of spring break. We're on our way to the library because I got another jury duty summons. So we're gonna fax that over and then we're gonna study. Then afterwards, I have to get my physical done and another TB test. So I'll see you guys in the day. So we left the library. I'm here waiting for my physical. In the meantime, I'm over here studying, reviewing what we learned for dental materials on the second exam. But after that, I'm gonna start working on radiology. I got the continuing education course done that we needed to do on panoramic radiography. Then afterwards, I think I'm gonna practice on the dentic a little bit, and then I'll show you kind of how I've improved. Big difference from first semester. I was watching the old videos and I was like, oof, the technique. But it's a lot better now. But I'll see you guys once I get home. Hello. It is Friday. Spring break is coming to a close and I'm finally getting myself together and actually like studying well. So I'm back at the library. Kind of what I have so far. I'm learning about the different types of tumors. I'm studying for pathology, and so I'm trying to get these slides memorized, and I have a test on one of my classes, which kind of covers like the different developmental stages like throughout life, and it covers it's going to be on like the different types of dental products, like the different types of floss, stuff for xerostomia and things like that. So I'll study for that too. And then I have my I brought my Dentec, so I'll practice that here too at the library. And then later I have to call in like half an hour my patient so I can go over his dental and medical history, and we'll see how that goes. So I'm gonna keep studying here and working on this, and I'll see you guys a little bit later so I can show you finally how I've been practicing on my Dentec. Hello, it is Monday. I had clinic today, but let me tell you how good Diosito is. So the patient that I brought in this morning, I was hoping to take a CAS, which is an FMX, like a full mouth series x-ray. He didn't qualify, and so I was like, I'm okay. I'm running out of time to get this requirement done for radiology class. So we're supposed to take a CIS and a panel by the end of the semester. But the panel, if we don't finish it, we can carry it on to the summer. And so I was like, oh, Diosito, praying this morning. I hope he qualifies. I hope I can get this requirement done. And so I wasn't upset. I was like, it's okay. You know, I haven't taken a single x-ray this whole semester. It's almost over, but that's all right. But then I was chatting with one of my classmates, and she's like, oh, well, this other classmate, she's taking a CIS. She's already taken one this semester. Do you want to take hers? And I was like, oh yeah, I'll do it. So I was able to get my CIS and my panel requirement done today with no retakes. And you know what? I was just telling Diosito, at least I hope I can get the CIS done. But what did he do? He got me the CIS and the panel. Wow. So right now, girl, I've been here desde las 6:30 and ya son las 4. I'm hungry. So now I'm just gonna go home and study for the quiz tomorrow for radiology on the panoramic errors. And then there's also a quiz for dental materials. So I'll see you guys mañana. Bye. Hello, it is Friday. I just finished doing Jerusalem sealants. Very exciting. I ended up doing 7 sealants. But tomorrow, Saturday, we have to be here. I have to be here at 10. They're doing like an event with kids so they can get their cleanings done. So that'll be exciting. So we're gonna be assisting the second years. They'll be the ones like they'll be the hygienist for the kiddos, and then we'll be like assistants. So we'll be assisting with the sealants, radiographs, documentation, all that fun stuff. So see you guys next time. Alright, this is in the SimLab. I was practicing with my instructor here to get a little bit of extra help. I feel it. No. So pay attention to my wrist in both clips, the one previously and this one. So I have what we call like a falling fulcrum. So as I rock with my wrist back and forth, my fulcrum drops. So this is what I was working on with my instructor, just keeping my wrist straight and my hand from falling. Alright, so I was in the sim lab with my professor yesterday, and I wanted to show you guys kind of what I was working on. So this is quad 2 on the buckles. I was having a hard time here, but with this one we can, hopefully you guys can see. I'll show you on one tooth. So this is the Gracie 1314, which is used on the distals of the teeth, the back part of the tooth here. So with this one, we insert here, and then what I was doing before was rocking like this, but teacher suggested that I go more like a downward motion, and then I can scrape the tooth a little bit more easier. So we'll go at the distal line angle, insert, go underneath the gum, and then now here's what the right. So now this is the 11-12. This one's used for the buccal and medial. So with this one, a little pre-roll. So we insert underneath the gum, and then come up, and then ta-da! And now another area that I was finding really challenging was this one. Now the linguals of the same quadrant, so we just did this side, so now this one. Let me grab the 13-14. So now with this one, I was sitting at 9 o'clock, so my torso was facing this way, but now I'm sitting at 8 o'clock, so I'm facing this way. And what I had been doing before, so at 9 o'clock, my wrist was bent, kind of like this. So it was hard for me to keep my wrist straight, and I was cramping up. So what we ended up doing was sitting at 8, and then hopefully you guys can see, we'll do this tooth here. So, and then at first I had my wrist like going this way, but if I have it more this way, here, how can I show you? Excellent. So let me show you what I mean. So before I had my arm like this, and I was trying to instrument like this, but if you can see, my wrist is bent. But if I come over this way, I can still access the tooth, but my wrist is more straight. So I'll keep it like, I'll zoom back in a little bit so you guys can see. I left my loop light in the sim lab yesterday, which is making this a lot harder for me to see, but so my wrist will stay the same. And then close the face, insert, and then ta-da. Now with the 11-12, so this is the correct working end. So with this one, go here, have my wrist like that, sitting at 8 o'clock. Do like a little pre-roll, insert, come up, and then do you guys see this or no? Oh, here we go. So with this one, I'll show you again. So this, roll it back, insert, come up, and then then another area where I was having a lot of trouble with was over here in the buckles of quad 1. So the buckles are these here. Instruments, back to the 13-14, and I was sitting at 9 and then retracting like this, having the patient face me a little bit. But what we found is that sitting at 8 o'clock is a little bit better for me. So we'll do this first molar here. You guys see, hopefully. Okay, so proper grasp here. Okay. Oh, and then another thing. So I was having trouble having the correct angulation. I'll show you. Okay, we'll do it like this. But I was having the proper angulation. So this is supposed to be parallel to the tooth. But sometimes I was finding that my instrument was like across the tooth surface. So what she suggested is to keep it parallel. You can move the instrument like this or like this in the arm, and it'll change the position of this part of the instrument. So maybe here, hang on. I'll turn this so you guys can see.
So here it is like at the V of my hand, but if you change the angle to the instrument to be higher up between like the third and second knuckle, look at how that changes. Now it's like here. You can see this better on the Primo. Now it's across the tooth surface, but if I switch it over to the V of my hand, it's now parallel. Slide it up and it goes across. So that was a huge game changer for me. But let me show you how I practice this quad. So I still have the patient facing me a little bit so that I can see a little bit more. And then I have, so here we are. Okay, see? Okay, so here we are. We do the distals. We have our fulcrum. This tooth is broken, hence why it's wiggly. But do it like this. Hopefully you guys can see. So we're gonna close the face, insert come up, and then we're just gonna rock. So much easier, and my wrist. So that was a lot of fun. So show you again, maybe from a different angle so you guys can see. So with the 13, 14, normally I would not have the patient like this. This is just so you guys can see what I'm doing. So we just did this tooth, so we have it parallel. Then we insert, come up, and then we're and we'll do this one here. Ta-da! Alright, so I just wanted to show you how I've been practicing at home. Today, I didn't have any patient to come in. We only have a couple more days left in the semester. I think we have like 4 weeks left. And I haven't been able to find a kid patient. If I don't find a kid patient, it's 2% deduction of my clinic grade. And as you know, we have to have a 75% to pass the class. If we don't pass the class, we're dismissed from the program. So and if we're allowed to have 2 days where we don't have somebody in the chair, and then after that, for every day you don't have anybody in the chair, it's 2% deduction of your grade. So I didn't want to have that going on, so I'm bringing in my mom, and if I don't finish her this semester, I can finish her in the summer, and it won't affect my grade. So I think that's what I'll do, and then hopefully she'll qualify for me to be seen this semester. If not, I could just see her in the summer. But I'm gonna keep trying to find a kid patient. I've gone to a couple grocery stores to hand out flyers. I've handed out some to people. I've been asking my neighbors, anybody. So far, no luck. But I did find a kid patient for the summer, so I'll have that. Hopefully that goes well. But I'm gonna keep looking. So I'll see you guys later, guys. So it is Tuesday. So I had dental radiology this morning, and we're finally learning how to use the sensors. So we're just practicing this morning on the little dexters, how to use the digital sensors. And we have to complete 4 CIS or full FMX, 4 full FMX on the little dexter for this semester. And then afterwards I had dental materials. And we took a quiz on amalgam. I passed. I got 100%, which is pretty nice. But right now I am at the library, and I'm like filling up the whiteboard with all the terms for oral pathology, because tomorrow we have exam 3, and it's two tests. So one is written, like multiple choice, and then the other one is like a slideshow. So she'll show you a picture, and you have to write down what the oral condition is. And I haven't been doing that great on those, but for this one I did something a little bit different. I created a Quizlet. I got the free trial for like the Quizlet Plus or whatever, so I did that. So I think it's working out pretty good, because I'm recognizing the pictures, and the little spelling feature is helping so that I spell everything out correctly. So this is my plan for like the next couple of hours, just to write everything down until I have to go home. But tomorrow will be the exam. Hopefully everything goes well. I feel more prepared for this one than I did for the second one. For the second one, I was trying to memorize the terms right up till the second I took the exam. And surprisingly, I got a B. You know what? I thank the Lord Jesus. Todo salió bien. Oh, I didn't even show you. Let me show you. Okay, so we got our second year kits with all the instruments. Let me show you. Here, what do we have? We have like a dispenser. Oh, this is like for injection. So we're not gonna use this as of right now, but let me show you. This is what it looks like. I don't know how to use this. I've never seen this, even though I worked as a dental assistant, but they told us that this is something that we were going to use pretty often, so I'm kind of excited. Ooh. Okay, kind of excited, but let me show you the rest. You know what, guys? I just saw that this says not for injection, so I don't know what it is. I thought it was for injections, but we'll see. And then we got like a new sharpening thing, and like I had shown you the sharpening stone that we have from the first semester, but this one's like a lot thinner, so I'm not sure how that one's gonna work, but excited nonetheless. Some of the second years were saying that they like that better. We have the little mosquitoes. We called these hemostats when I was assistant, but I guess there's multiple names to them. And then we have like a bunch like of universal and Langer curettes, which is kind of exciting. And I like these little colorful ones because they're super light compared to like the metal instruments. But these are pretty nice too. I think these are the implant scalers, the blue ones here. So excited for those. And then we also have these. We have more Gracie curettes, but I think these are, I know we had some minis that we were gonna get in, and then some rigids, so that's pretty exciting. And then we have more sickle scalers, also very exciting. ¿Cuáles son estos? These are some Nevis. So right now we've been working with Nevi 3 and Nevi 1, but this is like a Nevi 4, which is pretty exciting. I like the Nevis, the red ones here. And then here we have, here we have the Cavitron tips in the back. We've been using the slim line so far in clinic. Oh, and then we have the probes, which that is pretty exciting. I hope we get to start using the Cavitrons. But I know there was going to be a separate lab lecture for that one. And then here, oh, this one, I like how they call these. These are like the Queen of Hearts. Oh! So there's those. And then we have, I think, another Montana Jack. I tried that one. I didn't really like it too much, to be honest. A couple more Gracies. I need to get bands for these so that I need to engrave all of these actually, but so then this is the other one. So we have a Cavitron piece. This is just like a black handle for the Cavitron. So it's like a little black thing where we insert this in there. So this little metal piece goes into the black thing. We were not supposed to get this, but we got it in our kits. It's fine. And then we were missing, we had to turn in one of the Langer curettes this morning because they were supposed to be rigids and they came as like regulars. So we're waiting for those, but I'm kind of excited. Mañana, I was gonna engrave them today, but I didn't get the chance, so I'll bring these mañana and I can get those engraved. I'm gonna continue with this and I will see you guys mañana. You know what? Tomorrow is the last day. We're gonna have Thursday, Friday, Saturday, Sunday off. So we'll have like a 4-day weekend. And I'm gonna commit myself to not procrastinate and I'm gonna get my stuff done. So I'm gonna keep reviewing for oral pathology, what we have learned previously, because I'm pretty sure none of that stuck long term. There's just so much detail for every single condition, and some of the PowerPoints are like 50 slides, so that's like 50 conditions in just one chapter. This is 4 chapters that we gotta go through. Some of them were kind of nice, like 18, so not too bad, but this is what I'm gonna keep doing. So I'll see you guys. Okay, so I just got out of the exam for oral path. You know what? I did pretty good, not gonna lie. So it paid off to study a bit more. I wasn't as behind with the second exam, but ahorita I'm in one of the little rooms for where we practice taking x-rays, but I'm gonna engrave all of these that I got to engrave, but better now than later, so because I have time. Mañana we have a little break. We have 4-day weekend. Okay, finally finished engraving all the instruments. Took forever, like an hour almost, but let me show you. This is the Cavitron insert that I was telling you about. My name came out pretty good, I would say. I'm getting better at using the little thing, but put that there for now. But I'm done. I'm just gonna go to the sterilization room and sterilize some of the minis so we can use those on the vacations. And then ya me voy para la casa.
Guys, it's been a minute, but I have spent the afternoon at the park going around handing out flyers trying to find patients. So I officially completed all my requirements for clinic. We needed to have 5 patients this semester, 3 patients that were considered zeros and 2 ones. And this coming Friday, my friend was able to find me a kid patient, so I'll do my kid requirement for this semester. Had I not found a kid, I would have had a 2% reduction in the grade, which I definitely did not want. So now I'm just gonna head home. It's dark outside. It's like almost 9 o'clock, and I have a quiz tomorrow for oral pathology, and it's like on a bunch of disorders like hyperpituitarism, hyperparathyroidism, diabetes, and all that fun stuff. So now we're just gonna head home, and so I'll see you guys next time. Good morning. Today is officially the last Monday clinic. Super exciting, pero I'm here a little early. Today I'm gonna be doing sealants on my patient if he comes today, but we're gonna later this week I have my last exam for my, I believe it's the oral health strategies class. But other than that, I think we're done taking the exams. I just have to finish taking a CIS or full FMX x-rays using those sensors. I have 2 left that I have to complete. We have to do 4 for this semester, but once we get those finished, we'll be all set. And then Friday will be my last appointment. I did end up finding a kid patient, which was really exciting. We need to complete 6 by the end of the program. So it was required to have 1 kid patient this semester, otherwise we would get a 2% deduction. But luckily I did find the kid patient. So I'm gonna go ahead and head in, and then I'll see you guys later. Good morning. So today is officially the last day of clinic. It is Friday, so we are on the last day. And this morning I'm coming in to screen a patient to see if they qualify for perio, and then also have clinic at 1:30 to 5 to finish my last patient. It's a little kid patient, so I hope everything goes well. I'll see you guys later. Okay, so I just got out of clinic. It's like, not just, but it's like 9, almost 9 p.m. I just got out of school. I finished my kid patient. I still don't know what grade I got, but I have to turn in a reflection, a clinic reflection by 12, but we'll see how that goes. Okay, so I just gotta turn in the reflection, and then I'll be set with clinic, and then I just have finals next week. It'll be Monday, Tuesday, and Wednesday, and then yeah, that's it. So I'll see you guys para la próxima. So I'm at the library right now, and I am going to take advantage of that whiteboard over there. The whole wall's a whiteboard. I'm studying for oral pathology. The finals are coming up now that clinic is over. I still don't know what my final grade is. They closed the classroom on Blackboard, so I have to just wait and see. I submitted my reflection last night, like at 11. And then I'm just gonna keep working on oral path, and then I have my 3 different colors. So I'll write what I know in black, blue is what I need to learn, and red will be for my mistakes. And then I'm just gonna keep rewriting things over and over again and repeating them until I am confident that I know my stuff. So I'll see you guys. I'm at school. I have my first final exam today, and it's gonna be a lot of fun, like nutritional counseling, tobacco counseling, nutrition, orthodontics, prosthodontics, and a bunch of stuff like that. But I'm pretty excited. I got here early. It's like 6:30. It doesn't start until 8, so I want to study a little bit beforehand before going in. I need to get a 90 to keep my A, and A would be 92% and above, and I'm exactly at 92 point something, so we'll see if I can keep it. But I'll let you guys know how it went. Okay, I just got out of class. Well, no, I didn't. It's 7:41 p.m. I took the final for oral health assessment. I'm pretty sure I passed it.
It's not too bad. I've been studying for radiology for tomorrow's radiology final, and for dental materials. So I'm just gonna go home, review a little bit more, get up early like at 4, study for both of those, and then keep going. So I'll see you guys mañana. So I finished my finals today. Dental materials was hard. I don't know what that was, but oral pathology was worried for, but now we passed. Venimos a comer. This one over here got 100% on her final. Okay, so we're gonna eat and then we're gonna go home. I'll let you know how it went with my finals once we get the grade on Friday, guys. So it's end of the semester. It's a couple weeks after school has ended, but I didn't get to record a whole lot this semester, which I kind of regret, but I'm gonna do a lot better for the summer semester that starts in like 2 weeks or so, a week. And so I just kind of wanted to show you a little bit of kind of what I got to do throughout the semester that I didn't get to record. So I'll show you this. These are it's my little chapstick from dental materials class. This is a bite registration that we did. This one just broke, but these are whitening trays that we got to do. So my friend made this one for me of my teeth. So with this one, the little whitening tray is this little plastic thing here, and it's scalloped along the lines along the gums, and like this blue stuff here is to fill any voids, like air bubbles. This is what it looks like from the inside. It's not scalloped from the inside, but from the front it is. And then that blue on the teeth is to hold the whitening material. That's for the bottom teeth. This one's for the top. And then we also did retainers. This is the one my friend made of my teeth. This one's a little different. It's not scalloped like the other one. So like to compare, see the retainers on the top, you see how it's straight? So these are like scalloped, like those little half moon shaped across the teeth. And the material's a lot harder and thicker for this one. And then this is like the second pour up that I did. The first one came out so nice. This other one, on the other hand, had a ton of bubbles, as you can see. It's not ideal. These were a mold of a teeth that we just poured up, but eventually we got to the point where we were using alginate. I think this one here was like the first one that I did, and I was having the front teeth ended up breaking, which is not ideal. We got a chip there. I think on the way home it didn't survive very much, but it was a lot better than the other one. I didn't have as many bubbles, but these are some of the other ones. Did I do this one? Some of them are my own teeth, so we gave them back to our partners. We were like, okay, well, we can trade. So there's that one. And then this one as well. It's pretty cool. This one's of my teeth here. Pretty good. But, and then, so yeah, that's what we got to do in dental materials lab. We also had a guest speaker come in to talk about prosthetics, like the dentures, like how to put them on, how to use the adhesive. And then we eventually had someone come in to talk to us about whitening, and we ended up getting these kits. So we have the Philips Zoom whitening. Let me show you. So the one that I ended up getting was the carbamide one. It has 22% carbamide peroxide. This is the nighttime one, and then there was also the hydrogen peroxide one, which is the one that's worn in the daytime. But this one comes with like the EVA sheets, which is like that plastic thing. You put it over the model like this on top on a machine, and then it starts to melt, and then you drop it down, and then it gets suctioned, and then you get the little molds for the teeth, the little trays. But it comes with 2 of those, and then you have a little case to keep your little whitening trays in there, which is pretty nice. So this one is the carbamide one, and then I did trade with somebody so that I could try the daytime one. So the daytime one, I think you leave it on for like 30 to 90 minutes, and then the nighttime is like 2 to 4 hours. So I'm actually gonna try this out. Oh, what's this? Ooh, a shade guide. So these shade guides, you hold them up to your teeth and you just kind of compare to see where you are before and after. So I'll do that and see how well this works. I don't know if I'll include it in the vlog, but we'll see. But I'll try that out for sure. And for a different class, we did have somebody come in to talk about Oral-B, and we ended up getting the Oral-B IO. I think it's like one of the newer models. They told us it was like a $300 toothbrush. So let's take this out. These are the two toothbrush heads. They're not exactly the same. I forgot what the guy said about their difference. But he did say that with these toothbrush heads, like, you can clean them out from the inside and then, like, the water would spill out, which I don't think you could do with the Philips ones. But it comes with the charger here. I already took out this one out here. But with this case, I like that it actually closes, because with the Philips one, I could never get it to close. And then here's the little toothbrush. And then this one has, like, a color indicator light, so if you're like brushing too hard, it'll turn red, and it'll be green if you're on the right track. I think it's dead right now, but when he was doing the demo, like, it had little faces on here, so if you're like brushing too hard or not long enough, it would have like a little frowny face. But I do like that you can fit the two heads in here and that it actually closes, so you could take this if you need to travel or something. But so as of right now, I've been preparing for the summer semester. I've ordered my books, I registered for my classes, and we're gonna have 5 classes this summer. One is gonna be pharmacology, another radiology class. We'll have like a special needs class. I think like another like dental hygiene, oral assessment type of class, and then we'll have clinic. But with clinic, it's gonna be at a different level. So with the spring semester, that was our first semester seeing patients. Fall, we had just practiced on each other, but spring we saw our first patients. We saw 5 patients in 16 weeks, but now in the summer it'll be 8 weeks, and we'll need to complete 5 patients. And last semester we were completing patients that were classified as a 0 or a 1. Now it's gonna be, we'll need 1 patient that is a 2, 2 that are 1, and then I think 3 zeros, I believe. I have to double check. But it's definitely going to be a higher level. Our grading is going to be not as generous, because in the first, that spring semester, we were just kind of getting used to seeing patients, getting the flow of things. But now their expectations are going to be higher, so we're going to be graded a bit more heavily, which I'm a little worried about, but it'll be okay. And what else? I know I didn't do a good job recording during the spring semester. It was just a lot, and I was trying my best to record as much as I could, but it really was a lot. But I'm gonna try my best to record a lot more during the summer and be more consistent with posting. I want to thank you guys for tagging along with me in my dental hygiene journey. I hope you guys stick with me all the way through the end. Hopefully I pass all my classes and everything goes well, but everything is in God's hands. If I end up failing a class or it doesn't go the way I hoped, well, it just means God has a different plan for me. He's closing that door. Maybe it'll open back up, maybe not, but I'll try my best. With God, I know I can do it. But thank you so much for watching, and I'll see you guys in the summer.